Well, hello, and welcome to part 2 of Dashcam Diary of a Disabled with Chronically Happy. I am headed to my home. Well, actually, to drop off a bill close to my home. And stopping by Dutch Brothers to get my first Wednesday of the month sticker. I always forget to go the first Wednesday of every month to get my Dutch Brothers sticker. Now I need to go get my sticker and get another energy drink. That's why I started drinking my baby 8.4 ounce instead of a 12 ounce one this morning, because I was going to go get a Dutch Brothers one. A blended peach rebel. It's not Red Bull. Red Bull. It's Rebel. Like, I'm a rebel. Yeah. So the Dutch Brothers has flavored coffee flavors, and they do Italian sodas, which used to be one of my go-tos until I start, getting jacked up on energy drinks again, like I have been for like the last 8 months. I have a bad habit. I'm an addictive personality type person. I get addicted to things easily. It's because of my love of life, and it's my love of everything that life has to offer, the good, the bad, the ugly. So yeah, I'm on my way to go get my blended energy drink. So I like the fact that it's a little bit watered down because it's blended with ice, and then it's got ice and it's blended, so it's like slushy. That's why I like it. It's energy drink slushy. It's so amazing, and they can have any flavor you want. I usually do peach, but you know what? I might do watermelon today, or I might do a combination of peach watermelon. I can do any flavors I want. What is the hold up here? This road never has traffic like this. Excuse me. Oh, it's raining and it's kind of muddy, and a truck is a full load, and he was trying to turn, I guess. I don't know what his problem was, but there's a bicyclist on the road, and he is crazy for being in this rainy weather. Dude, you're crazy. I don't know why I almost flipped him off. There's no reason to flip off a freaking bicyclist. I think it's just because I don't like bicyclists. They get in the way, man. Anyway, so part 2. Part 1 of my dash cam for my posting today talked about going to urgent care yesterday, seeing my primary care physician as my urgent care doctor, which was helpful, but also not helpful because he knows my history, but unhelpful because he doesn't want to manage my pain. So I went there for imaging and pain management, knowing, I tried to go with open heart and mind, whether I get told yes or no. I have been denied opioids so many times. I've been called a drug seeker by doctors left and right throughout my entire medical journey. And I have no problem saying no to opioids. I really don't have a problem saying no. What I have a problem with is doctors telling me no when a patient clearly needs some kind of pain management. And if they're already in a pain management program like I already am, it makes it that much more complicated to try and control your pain by any other means. Acute injury or surgery is extremely difficult to manage pain for somebody that's already on a maintenance pain patch dose that helps their chronic pain. But when it comes to acute pain and acute injury, the doctors answer, so my primary care doctor referred me to a pain management doctor, which is an internal medicine doctor at the same clinic that he works at. He's an internal medicine doctor that practices pain management for pretty much every doctor in the clinic. Will try to send them to him to help manage their pain rather than send them out of office. It helps them get more money in their pockets in their clinic by having somebody that is certified in pain management and has done all the extra courses and stuff. And I'm so thankful for this pain management doctor. I absolutely was unsure about him at first, but it was a blessing in disguise because the pain patch is what I've needed all along instead of this opioid journey of being on and off opioids for, oh my gosh, I started in like 2008 and I finally got on pain patches in 2020. It was after surgery, so after 2020. I've been on them for over a year at least. I might be coming up on 2 years here pretty soon. In the next like 3 or 4 months, it'll be 2 years that I've been on these patches. It's taken me this long to get surgery, and I'm still waiting for a surgery date. So anyway, I just had to give a little context about my pain management doctor and his credentials and where he is and what kind of, treatment he does. He also does acupuncture, which I'm currently awaiting my insurance to approve. I'm actually going to call them today if I can get around to it between my other phone calls and everything else I need to do and pay bills and trying to explain to the credit card company why my payment is, again, the 3rd month in a row late and unpaid so far. I was in the process of trying to take care of all that yesterday, but my day was interrupted first thing in the morning with an injury. So it took me all day to deal with just trying to get pain management for this new acute injury, which luckily, the only way I know I can evaluate and feel reassured by any doctor is my chiropractor. Him and I have a long-standing relationship about what my pain pattern looks like, how my body adapts and changes according to what treatment I do to it. Whether it's my pain patches, whether it's my infusions for my immunodeficiency. Those are the things that have majorly changed my pain pattern with my chiropractor and made it to a point where I can see my chiropractor once, sometimes a couple times a week, depending on the weather, depending on my body, what I've put it through, what I choose to do to put myself into flares by going to raves and dancing and totally exhausting my body and putting it through so much fatigue that it's so unstable from too much activity because I do too much. I don't let my body rest enough for what it really needs. And daily life requires more from me than what my body allows. But I have to live a life, and I want to live a life that I am doing things that I enjoy while also still taking care of myself and my body and my mental, emotional state, dealing with all of this medical crap that I don't want to be dealing with. I don't want to be making these phone calls. I don't like being put on hold. I don't like having to do authorizations every couple months and leaving messages with VA personnel and then having them call me back at random times that I'm busy doing other doctor appointments or other things or other testing that I cannot answer the phone, and then I go to call them back and then I get the answering machine again. And so then it's a vicious cycle of phone tag and authorizations and trying to get scheduled with physical therapy when they're booked 3-4 months in advance, and then having the VA authorize only 10 visits at a time. So then I'm in this perpetual cycle of I need this authorization ran. I need this authorization ran basically once a month because I do my 10 visits as fast as possible because I want to go at least twice a week, but really with their schedule, they can only allow me to go to physical therapy once a week, when really I need physical therapy 5 days a week. I can't do it myself. It's pelvic floor physical therapy, and it's essentially fascia release, because I get adhesions because of my connective tissue being sticky. And so I have adhesions where my colon gets stuck, my intestines get stuck to my abdominal wall, my bladder tilts, and then I can't pee, and I have to cath, there's so many things with my unstable body that I have to consider, and I don't have the knowledge and training to do it myself, to do my own 5-day-a-week physical therapy for myofascial release and lymphatic drainage kind of stuff. Things like that I really need on the daily to help keep my body functional, but also not keep it in this constant state of unalignment, realignment, without being able to strengthen my body while it's in alignment, because I'm throwing it out of alignment trying to get it strengthened, because then I injure myself trying to strengthen it. It is one vicious cycle of hardship to deal with a body that doesn't function properly. So I'm very complex, and my pain is complex, and my pain is different every day. And so regular pain scales mean nothing to me. They mean nothing. I'm in various levels of pain. Every minute of every day, the level changes. Like right now, my pain is probably about a 4. I would like a throbbing pain in my right butt cheek, under part of my leg, kind of sciatica kind of area, but it's not quite running out the outside of my hip side. It's down, and it's more muscular feeling, and it's my fascia and muscles and ligaments and tendons shifting from the position that I'm sitting in my car. They are figuring out a place for them to go. So I feel my body inside right now shifting by signals from it's not pain signals, but there's signals telling me that there's change going on in my body right now, and I feel it. I feel like it's a dull sensation that's that just some could maybe consider it a pain, but it's a weird sensation of just feeling things shift, but it's not like a very distinct feeling of like a thunk kind of feeling. It's a I don't know. I feel like I feel my nerve fibers. I can't describe it very well. It's very difficult, because unless you have EDS, it's kind of hard to describe, and even people with EDS aren't this grounded because they're trying to dissociate the pain. And that's what a lot of people are trying to do nonstop, is trying to dissociate the pain and not be in pain. So they're not trying to think about it. So a lot of people self-medicate with all kinds of substances to try and not feel the pain. I feel like they're just sensations. It's not necessarily pain, because thanks to my pain patch, it blocks pain signals. So instead of those pain signals being like fibromyalgia is a symptom of EDS in my mind, that's how I kind of think of it as. It's fibromyalgia type symptoms of nerves misfiring, but they're not really misfiring. They're just not really firing, but they are firing, but my brain doesn't recognize what those firings are because of the medication. It doesn't recognize it. It's like, what is this? Something's going on. Something's different. And I feel pain in my descending colon. I finally got something to shift in my colon and intestines. I have been constipated for days, and that's another reason why I know, a little TMI, guys. I know, TMI, but the constipation's been bad, and I really need to have a movement, man. And I've had a blockage in my intestine because I've been really gassy, and I haven't really felt the inflammation because the injury pain signals took over yesterday. So I really haven't been having the gut pain and intestinal issues I would normally feel with constipation, but things are changing in my body nonstop, and it just depends on how I'm sitting, how my mood is. If I keep my mood steady, it does keep my pain less. The more stressed I get and the more upset I get about things, the more pain I'm going to be in. And this Dutch Brothers is busy. I don't know if I should have gone to the other one. I'm just going to... Oh, gosh, this is a long freaking line. Well, I have nothing else to do besides talk, so I'm going to just get in line here and wait. I hope this person is not parked. Is this person parked, or are they even in their car? I don't know what they're doing. I'm just going to sit here and hopefully they move. I don't see their car lights on or brake lights on, so evidently they're in park. Whatever. So, given all that context, part 2 of my story. So after 16 minutes, I'm like, let me finish my story after all the unneeded TMI and disruption with my ADHD brain. So when my primary care doctor messaged my pain management doctor, because they're in the same clinic, he got the message to him stat, and then their office got a hold of me and asked me if I still had the pills. I fibbed and said I don't, because I don't want to increase the pain. I have those pills still because I'm holding on to them for after surgery. I told my doctor that, but I kind of lied yesterday and told the staff that no, I do not have them, because I am not, when I do take them, which I'm not lying. Okay, so I lied, but I didn't lie. I lied about having them, but I'm not lying about what I told them, which is when I take an extra pill on top of this patch of the same medication, it makes me extremely nauseous and sick. My body is on overload. It cannot tolerate large doses of medicine. It cannot. It takes a while to taper up to that. And even the little teeny piece, no matter how, I've tried a couple times. I'm not going to lie, I've tried it a couple times to take an extra pill for breakthrough pain, because I've been in extreme pain at other times, but not to the extent of yesterday. But almost. I've had other small falls and injuries, but hold on. Order time. Order complete. That was really fast. Look at Merry and Amped is this month's Dutch Brothers sticker. I don't even have a specific spot that I have all my Dutch Brothers stickers. I just like collecting them because I like that people collect them too. I'm a hoarder of collecting things. I'm a completionist. I like to collect things in complete sets. But anyway, that's besides the point. I never get these stickers every month because I always forget which day it is. And I always go to Cairo on Wednesdays, but I always forget about it being the first of the month to get a sticker. So I didn't get last month's, which Halloween is my favorite freaking month. So it was probably one of the coolest stickers last month. And for November, why would they do a Christmas one in November? Come on, man. Oh, probably going to do some kind of like New Year's one or something for next month now, for December. Anyway, so back to the story. So the reason the staff asked me if I had any pills left over is because they recommended that I use that for breakthrough pain. That's what my doctor has told me on several occasions. Use it for breakthrough pain. And I told them on the phone, I'm like, it makes me feel sick to take extra. I got rid of them because it makes me sick. I can't take extra of it. And so she's like, I'll let the doctor know and get back to you. So some time goes by, and I was actually on the way to the ER the first time they called me and asked me that. And I turned around and I'm like, okay, maybe I can get something from him after I tell him that. Maybe he'll, come up with giving me opioids anyways, since I can't take extra of the pill like he wants me to. This doctor absolutely does not want me on any opioids. I just thought, maybe with a major acute injury like this, with as much pain as I was in, maybe he would freaking bend. Maybe he would freaking bend a knee. But I wasn't holding out. I was holding out, but I'm like, you know what? I need to have imaging completed anyway. Urgent care only did my hand, my wrist, my elbow, my hip, and my knee. Everything came back fine on the right side of my body, and I think that's the side I landed on. Well, towards the evening, and even with the extra opioids from the ER, I'm kind of jumping ahead here, but the doctor, when they got back, my pain management doctor's office got back to me. By then, I had already started going to the ER. I had to have I took a very strong Xanax, because I know it helps with pain. It works on your central nervous system. And doctors do like to sometimes offer that in the ER. So I got a head start on it and just took one myself. Well, come to find out, this ER doctor did actually offer me an Ativan, which is a long-acting benzodiazepine, which is the same class as Xanax, which is a benzodiazepine. The difference is Ativan is a longer lasting, it's not as strong, but it's longer lasting benzodiazepine. Xanax is a fast and a little bit stronger of a benzodiazepine. That's why there's such a stigma with Xanax, because of the high potency to abuse, because it's so strong and the withdrawals are, terrible. And the withdrawals, and you can also have long-term benzodiazepine side effects with your central nervous system. You can end up with permanent tremors and tics by taking it long-term. So I do not take it lightly that I am on benzodiazepines long-term and regularly, but it helps with my mast cell disease and my POTS. It's a mast cell stabilizer, so that's mainly why I'm on it. But the Xanax is also to help me sleep and for panic attacks. So I had preemptively taken a strong Xanax before I even went to the AR. For one, I was already in a very kind of hypochondriac state and a panic state because of my pain. Every time I have an acute injury, it's very traumatic for me because I never know how it's going to pan out in the long run. Oh my gosh, I wish I had my physical therapist. Oh my gosh. My intestines are adhesed right now. Oh, now that I'm finally realigned, the physical therapy would be really beneficial right now. Oh. Thank goodness caffeine is like a vasodilator, that it really helps me go, just like coffee does. So there's also a benefit for my caffeine use in the morning. It does help me go. A little TMI again. Excuse the TMI, but yes, everybody has movements, and poo poo pee pee, caca, whatever. Trying to make a joke out of it. It wasn't in the right tone either, tone of voice, for joke. Anyways, so anyway, my pain management doctor, when the office called me back while I was on my way to the ER, they said, the doctor has called in a prescription for 20 microgram patches for me, which is double the dose of what I'm on. So when I tell him that taking even a quarter of a pill gets me nauseous and sick, and my body does not tolerate the extra pill, why would he think that I would want to double the dosage when my body won't even tolerate a small extra amount? Why would I want to double my pain patch? This pain patch, I do not take lightly. I do not want to even be on this pain patch. I do because it helps my pain. But I've experienced withdrawal from every kind of medication. I've been through withdrawal from Adderall. I've been through withdrawal from oxycodone. I've been through withdrawal from Vicodin. I've been through withdrawal from this pain patch even. Not on purpose on the pain patch, but I tried to reapply a patch. When they say you can't try to reapply it, you really can't reapply it. You think it's attached and it's not. It's not delivering the meds. Well, that's what happened to me. I took it off and tried to reapply it, and I ended up in severe withdrawal. I felt like I was not going to wake up. I'm just going to put it that way because I'm not trying to have the algorithm tag me or flag me because of certain words. I know YouTube's not as bad as Facebook, but I still am not going to try and say words like, that starts with a P, but the word corn, or like, I'm trying to think of other examples, but it doesn't matter. It doesn't matter. So that was my pain management doctor's solution, was to double my pain patch. When? Now, I also have to take this into consideration. I am waiting for spinal cord surgery. My neurosurgeon would prefer that I got off this pain patch and onto regular opioids, so it would help her manage my pain after surgery. Because she's only treated one other person on this type of pain patch after surgery, because they stayed on the pain patch and then they were still on the patch after surgery. They had a hard time managing her pain. They were so scared of overdosing her. But what's even funnier is when the ER doctor had the discussion, when I had the discussion with the ER doctor about opioids, he tried to scare me into saying I will start to have withdrawal symptoms from taking opioids with this patch. I do not feel any withdrawals. The only thing that I may have slightly felt, because I have not taken any more pain meds since they gave me any in the ER yesterday, which they gave me the pain meds at, I don't know, probably around 5-6 p.m. last night. Now that I've been to my chiro, my pain is still there, but it's not much worse than what it normally is. I mean, it's probably like a level 3 higher than my normal pain when it's exacerbated. So I do have breakthrough pain when I do things, lots of activity and lifting and loading my car and going to festivals and that. And then I know to give my body extra rest afterwards. Well, it wasn't even necessarily my fault, but it was my dog's fault that made me fall. She pulled me over a curb and made me fall on a curb. because she pulled too hard. And I have been working with her and training her, and I don't understand how she changed her behavior in the matter of a day and pulled me over. She normally does not do that. She doesn't pull like that regularly. So it really fucking took me off balance, and it really messed me up. Like, that fall was so unexpected. Maybe the reason why I didn't get as bad is because I didn't have a chance to really tense my body up to protect myself for the fall, which is what your body just does automatically. And with my slow, dysfunction, ADHD, neurospicy brain of processing what's happening at that moment, like there was an old man that was sitting right there next to where I fell. Like, he was like within arm's reach. Like, he could have almost caught my fall for me. Like, he was so close. But he was sitting down on a table next to there's a coffee shop right next to the dog spa place. So there is that. I can't believe I fell. It really took me off guard. I wasn't ready for her to pull like that. Like, if she had a tendency to be pulling like that all the time, I would have been more braced and ready for that when she came out of the car. But she jumped out of the car and just pulled me over. Like, I had no good footing. I had just opened the door. I had just unhooked her leash, and I was like kind of moving out of her way to get her, So I had to block her from jumping out of the car before I unhook her from the seatbelt. But she was just overly excited, and she hadn't had her exercise or playtime yet because I just woke up and had just enough time to take her. So, there were a couple factors that weren't really thought about in the moment or beforehand to be prepared for her to pull me over. And of course I didn't yell at her. I didn't get mad at her or, take it out on her. It's not her fault. I mean, it was her fault, but she has off and on a tendency to pull really flipping hard. But I've been really working with her on that lately, and I thought it was good, and evidently not. She's not good. We absolutely need to get her into obedience, and I just don't know how to find the time to do that between everything else I do. I just don't know how to fit that into my schedule yet, because I don't even keep up with everything now that I need to. I am behind schedule on a lot of things, so I don't feel like I should try to throw that into my mix and complicate it by adding just another thing I have to do every day, or several times a week or once a week or whatever the schedule is. But we need more consistency and routine, and we don't have that. If we had that, this wouldn't be an issue at the moment. But I've really been not present most of the summer, and I haven't had many training sessions with her lately. She's been watched after by my parents and my uncle a lot more, and her behavior is different depending on who's taking care of her. Her behavior, since I've been so absent, it has been whining, because my parents will reinforce her whining behavior and give in to whatever she wants. And my mom views my training my dog as a negative thing. And she's like, I feel sorry for her being attached to your hip all day, you know, that does not help support me and my training. Like, I honestly feel like I just need to be like, she's your dog, Mom. I need to get a real service dog because you have essentially undone the training I've given her because you don't. She reinforces negative behaviors. I do not allow her to, or I try to change her behaviors with positive reinforcement and stuff. Like, sometimes, yes, I'm frustrated, and that doesn't help the situation. And so, if I get frustrated, it's the time to stop training and let my dog do what she needs to do. But my mom views her more of a pet than an actual helper to me. Instead of a helper, my dog is now becoming more of a pet and pulling and hurting me instead of helping me. My dog is hurting me instead of helping me because of my mom not helping me reinforce the training that she needs to stay by my side and stay more calm and not play nonstop. She needs to have her brain working in a more intelligent manner rather than a more reactive dog. Play, play, play. This is what my life's purpose is I just want to play all day long. When her life's purpose for me is to help me not fall. Instead, she is making me fall because my mom has walked her and she allows her to pull on the leash, and she doesn't reinforce it the way I do. And so, since there's no consistency and the type of training that my mom or myself do, there's nothing consistent across the board. So that's why my dog is not service dog credible. She does mind she can be in public places, she can do it just depends on the day, and it depends on her activity level, if she got any exercise out in the morning. She does need to be walked several times a day with being a lab, but physically I can't do that, and I can't do that in the rain with my scooter. And so there's barriers to her getting the required amount of exercise, which honestly what I should be doing is getting a dog walker to walk her daily for me. If I had a caretaker, that's a task that I would have a caretaker do for me, is walk my dog. But they're not necessarily trained for helping dogs. So I need to be the one that, she associates with service dog stuff, but she can't differentiate that with the way things are. She thinks that she has to play all day long, and my parents give in, and they do. They play with her all day long because she doesn't get her exercise outside, which is good that they do that, but that's also teaching her that her life's purpose is to just play. And when she does anything other than play, she is very sassy and whines and just doesn't behave. She won't behave. She does not behave very well anymore because of this inconsistency and no routine. And I know exactly that's why she is the way she is. And I keep trying, and I have too much on my plate with needing surgery and having all these medical appointments nonstop. It's just there's no consistency, and it's what we need. And unfortunately, she has bone spurs, so she is not technically eligible to be the type of service dog I need her to be for stability. So I feel like I've put all this money into her being my service dog, and it's been a waste. Because everything I've done has been undone. And she has this physical and immune system issues too. So she's not always well either. It sucks. Alright, so I am just finally made the payment that I have been trying to make for over a week now. I can't believe it took until Wednesday to get my freaking payment in. There is no grace period for this place. This is where I rent. I dropped off payment. They only take cash or check. They don't do debit card or payment online. They don't do any of that. It's $50 a month to store my trailer outside in a parking lot that has a fence around it, so I know it's safe. I need to get a tarp over it because of the rain, and I have a leak around my AC unit, and I need to get my trailer covered. I have so many things I need to get done, and I have such physical limitations, especially right now with my injury. I really have to take it easy. I do not want to pull everything I just got adjusted from the chiropractor back out, which, yeah, the chiropractor got as much as he could back. And I'm so thankful. And I'm not in as much pain. And I'm happy. A lot happier than I was on the way there. You know, I was laughing. It was a sad laugh. It was a grieving laugh. My shoulder just popped again. It just keeps popping. I am so upset about my shoulder and my neck again. Because honestly, that's what my chiropractor and I learned today during my adjustment, that my already destabilized left shoulder got even more jacked up in this fall. I fell on my right hip, and the right hip gains stability from your left shoulder, and so I had that cross pattern jacked upness again. But my neck sustained quite a bit of whiplash yesterday. I did not hit my head. Luckily, but it did a number on me. That fall did a number on me, for sure. I mean, my ulnar nerve, my elbow. I have my elbow pad on to help protect that elbow from being compressed when I rest my arm on stuff. My ulnar nerve is never going to be pinched again, but I am having issues in my pinky. I had jammed it really bad back in August, and now I just injured it again in the opposite direction. So I have so much damage in my dominant hand now. I am inevitably going to have some type of surgery. I have to. I just have to. I can't. It's not dire right now. I can still use it. It's just freaking painful, man. And I know the arthritis and everything is just going to continue with more pain. This is the most painful part right now besides my left shoulder. My hands hurt the most. It is affecting my gaming. It affects everything I do. It's my dominant hand. I can't text very well. Using my hand and thumb and stuff to try and text, it hurts so bad. My thumb joint is attached to my pinky joint or something because it hurts. My entire hand hurts. My upper shoulders and neck and body is what took the most damage, and not the bottom. I'm home. So I'm going to get out of here. This is a long update, number 2. So anyways, thank you all for listening. And yeah, I did a number on myself, guys. I am so much more disabled than before. I can't stop hurting myself. I tried telling them, you need to give me a damn surgery date. My symptoms are getting worse. And now look, I have an injury. I really need to MRI my neck and my shoulders. I really need to get that MRI done. I don't know what I did to it, but I need to know. But is it relevant to my tethered cord surgery? I don't know if it's going to do anything to affect that. I hope not. It just means that I'm going to have to line up a surgery right after, you know. I don't know what surgery I'm going to go after next. I mean, I have to fix my nose. I have to fix my hand now. Oh, I just jammed my freaking pinky. I just hit my pinky finger, jammed it, closed it, popped it. Ah, damn it. I never noticed that little totem pole, like an Indian totem pole in his yard. It's kind of cool. Never seen that before today. Anyways, yeah, I love y'all. I'm going to keep being positive and chronically happy and keep being me. Sorry for the lack of posts of, you know, dash cams and stuff for a while. I've been busy doing other things, as y'all have seen. So, I'm going to make another video later about other things. And this is strictly about my fall and accident and context between everything with my dog and my fall and my urgent care, my doctor visits, and my medication management, all wrapped into one today. So check, 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 check. Those topics covered. Updated. Hope y'all have a fantastic week. Happy hump day. I gotta go get some phone calls made and give some updates. Peace out.